The probiotic that lives in your mouth. What if one of the most interesting probiotics for throat health, bad breath, and oral microbiome balance is not mainly a gut probiotic at all? When most people hear the word probiotic, they think about digestion, bloating, gut health, or fermented foods like yogurt and kefir. But today, we are looking at a different kind of probiotic story, one that begins in the mouth. Meet Streptococcus salivarius, a friendly bacterial species naturally found in the human oral cavity. It is one of the early colonizers of the mouth, meaning it can appear very early in life and may become part of the normal oral microbiome. But here is the key point. Not every Streptococcus is the same. Some Streptococcus species can cause disease, such as Streptococcus pyogenes, the bacterium behind many cases of strep throat. But Streptococcus salivarius is generally considered a beneficial commensal species, especially when we talk about specific probiotic strains such as Streptococcus salivarius K12 and Streptococcus salivarius M18. In this video, we will explain what Streptococcus salivarius is, how K12 and M18 are different, what PubMed research suggests about throat health, tonsillitis, pharyngitis, oral microbiome balance, bad breath, dental plaque, and safety, all in simple language. This is not medical advice, and probiotics should never replace diagnosis or treatment from a doctor or dentist. But if you are interested in oral probiotics, throat probiotics, probiotics for bad breath, or the science of the mouth microbiome, this video will give you a clear and evidence-based overview. What is Streptococcus salivarius? Streptococcus salivarius is a gram-positive bacterium commonly found in the mouth, saliva, tongue, throat, and upper respiratory tract. In simple terms, it is one of the bacteria that can live peacefully with us in the oral environment. The word salivarius comes from saliva because this species is strongly associated with the salivary environment. It is often found on the tongue, in saliva, and around oral surfaces. But the most important concept is this: probiotic benefits are strain-specific. That means we cannot say Streptococcus salivarius does everything. Instead, we need to look at specific strains. The two most discussed probiotic strains are Streptococcus salivarius K12, often linked with throat health, tonsil health, pharyngitis research, halitosis, and upper respiratory tract support. Streptococcus salivarius, often linked with dental health, plaque, gum health, and Streptococcus mutans, a bacterium associated with dental caries. So, K12 and M18 are not the same product, not the same strain, and not always used for the same purpose. Think of Streptococcus salivarius like a family name. K12 and M18 are specific family members with different skills. For YouTube viewers in the United States, United Kingdom, Canada, Australia, and Europe, this distinction is very important because many probiotic supplements advertise oral probiotic benefits, but the strain name tells you what the research is actually about. A good probiotic label should show the full strain, such as Streptococcus salivarius K12 or Streptococcus salivarius M18, not just the species name. How can an oral probiotic work? Most gut probiotics are swallowed, but oral probiotics are different. A Streptococcus salivarius lozenge is usually designed to dissolve slowly in the mouth. This gives the probiotic a chance to interact with the tongue, saliva, throat, and oral surfaces. The goal is not simply to send bacteria down into the stomach. The goal is to support a healthier oral and throat microbiome. One of the most interesting mechanisms is the production of natural antimicrobial compounds called bacteriocins. In the case of S. salivarius K12, researchers often discuss compounds known as salivaricins. These compounds may help the probiotic compete with certain unwanted bacteria in the oral cavity. A simple way to understand this is, the mouth is like a crowded city. Many microbes are trying to live there. A beneficial oral probiotic may help occupy space, compete for attachment points, and produce compounds that make it harder for certain harmful microbes to dominate. This does not mean the probiotic sterilizes the mouth. A healthy mouth is not bacteria-free. A healthy mouth has balance. That balance is important for breath, throat comfort, dental plaque, gum health, and overall oral microbiome resilience. But there is an important warning. A probiotic is not an antibiotic. If someone has confirmed strep throat, high fever, severe tonsil pain, difficulty swallowing, repeated infections, or symptoms that are getting worse, they should speak with a healthcare professional. Streptococcus salivarius and throat health. Streptococcus salivarius K12 is probably the best-known oral probiotic strain in this species. K12 has been studied for throat-related topics such as pharyngitis, tonsillitis, pharyngotonsillitis, and recurrent sore throat episodes. It has also been discussed in relation to Streptococcus pyogenes, the group A strep bacterium that can cause strep throat. The reason K12 became interesting is its ability to produce bacteriocin-like inhibitory substances. In laboratory settings, these substances may inhibit certain bacteria associated with throat infections. Clinical studies have explored whether daily use of K12 can reduce the recurrence of some throat infections, especially in people with a history of repeated episodes. Research suggests that Streptococcus salivarius may help support throat microbiome balance and may reduce recurrence in some groups. But it should not be presented as a cure for acute strep throat. It should not replace a throat swab, medical diagnosis, or antibiotics when antibiotics are truly needed. This matters especially where sore throat is one of the most common reasons people seek care. Many sore throats are viral, but Group A strep requires proper testing and medical decision-making. So the most accurate phrase is not K12 cures strep throat. The better phrase is K12 is an oral probiotic strain studied for throat microbiome support and recurrence reduction in some clinical contexts. Ear health and upper respiratory support. Some research on Streptococcus salivarius also discusses ear, nose, and throat health more broadly. This includes topics like acute otitis media, which is a common middle ear infection, especially in children. Researchers have explored whether supporting the oral and nasopharyngeal microbiome may influence the risk of certain upper respiratory or ear-related episodes. The idea makes sense biologically because the mouth, throat, nose, adenoids, and middle ear are connected through the upper airway system. Microbial balance in one area may influence nearby areas. However, we need to be careful. This does not mean that an oral probiotic can treat an ear infection. Ear infections can require medical evaluation, especially in children, if there is fever, severe pain, hearing changes, discharge, or repeated episodes. The more responsible interpretation is this: Streptococcus salivarius may be part of a prevention-focused oral microbiome strategy in selected people, but it is not an emergency treatment and not a replacement for pediatric care. If you are considering an oral probiotic for children, choose a strain that has actually been studied in children, use age-appropriate products, and talk to a pediatrician if your child has recurrent infections, immune problems, or ongoing symptoms. Streptococcus salivarius and bad breath. Another reason people search for Streptococcus salivarius is bad breath, also called halitosis. Bad breath can have many causes: dry mouth, poor tongue cleaning, gum disease, cavities, tonsil stones, smoking, certain foods, reflux, and some medical conditions. But in many cases, bad breath is linked to microbial activity on the tongue and in the mouth. Certain bacteria produce volatile sulfur compounds, sometimes called VSCs. These compounds can smell unpleasant. Oral probiotics like Streptococcus salivarius have been studied for their potential role in shifting the oral microbiome and reducing odor-related compounds in some people. This is why Streptococcus salivarius appears in many oral probiotic for bad breath supplements, lozenges, and chewable products. But again, the strain matters and the cause matters. If bad breath comes from gum disease, cavities, tonsil stones, untreated dental infection, or severe dry mouth, a probiotic alone will not solve the root problem. Good oral hygiene still matters. Brushing, flossing, cleaning the tongue, hydration, regular dental visits, and treating gum disease when present. A helpful way to explain this is oral probiotics may support the ecosystem, but dental hygiene manages the environment. For the best chance of benefit, many oral probiotic products are taken after brushing at night, so the probiotic can remain in contact with the mouth for longer. But people should always follow the product instructions. Streptococcus salivarius and dental health. Now let's talk about Streptococcus salivarius M18. While K12 is often associated with throat and breath topics, M18 is more often discussed in relation to teeth, gums, plaque, and dental caries risk. One of the key bacteria in dental caries research is Streptococcus mutans. This bacterium can contribute to acid production and enamel demineralization when diet, plaque, sugar exposure, and oral hygiene create the right conditions. M18 has been studied because it may help influence oral microbial balance, including interactions with S mutans. Some studies have looked at plaque, gingival inflammation, salivary buffering capacity, and other oral health markers. But it is very important to say this clearly. M18 is not a replacement for brushing, flossing, fluoride toothpaste, dental cleanings, or reducing frequent sugar exposure. Dental health is built on the basics. Probiotics may be supportive, but they are not magic. A strong dental routine includes brushing twice daily with fluoride toothpaste, flossing or interdental cleaning, cleaning the tongue, limiting frequent sugar snacks and acidic drinks, visiting a dentist regularly, considering oral probiotics only as an additional tool, not the foundation. K12 versus M18. Which one is better? People often ask, should I choose Streptococcus salivarius K12 or M18? The answer depends on the goal. If your main interest is throat health, tonsil health, pharyngitis recurrence support, or bad breath, K12 is the strain most commonly discussed. If your main interest is dental plaque, gum health, tooth decay risk, or Streptococcus mutans, M18 may be more relevant. But some oral probiotic products combine K12 and M18 because they target different areas of oral health. The best choice depends on the person, the reason for use, age, health history, and the product quality. A high-quality label should show the full strain name, the CFU amount, the expiration date, storage instructions, whether the probiotic is designed as a lozenge, chewable, powder, or capsule, clear instructions for use, no exaggerated claims like cures strep throat overnight or eliminates cavities forever. If a product hides the strain name, makes extreme medical claims, or does not explain how to use it, be cautious. For oral probiotics, delivery matters. A lozenge that dissolves slowly in the mouth is often more logical for oral and throat microbiome support than a capsule that is swallowed immediately. Who might be interested in Streptococcus salivarius? Streptococcus salivarius may interest several groups of people. First, people who experience recurrent throat discomfort or have a history of repeated tonsillitis or pharyngitis may search for K12. These viewers want to know whether an oral probiotic can support throat microbiome balance. Second, people with bad breath may search for oral probiotics for halitosis. They may be looking for a deeper solution than mouthwash, especially if the problem seems related to tongue coating or oral microbiome imbalance. Third, people interested in dental health may search for M18 because of its link with plaque, gum health, and S mutans research. Fourth, parents may search for oral probiotics for kids, especially if their children experience frequent sore throats. But children should use age-appropriate products, and parents should discuss recurrent infections with a healthcare professional. Fifth, people who use antibiotics frequently may be interested in rebuilding microbial balance. But oral probiotics should not interfere with antibiotic treatment. Timing should be discussed with a clinician when antibiotics are prescribed. And finally, people who care about the oral microbiome may simply want a science-based way to support the mouth's natural ecosystem. The most important message is match the strain to the goal. Safety, side effects, and who should be careful. For healthy people, Streptococcus salivarius, K12 and M18 are generally discussed as well-tolerated oral probiotic strains in the scientific literature. But no supplement is risk-free for every person. People should be more careful if they are immunocompromised, have a serious underlying illness, have a central venous catheter, recently had major surgery, have a history of heart valve disease, or are using immune-suppressing medication. Pregnant people, infants, and people with complex medical conditions should ask a healthcare professional before using probiotic supplements. Possible mild side effects may include temporary digestive changes, mouth irritation, or taste changes, depending on the product. Allergens and sweeteners also matter, especially in chewables or lozenges. Another safety point is dental. Some lozenges contain sweeteners or acids. A product designed for oral health should not work against tooth health. Sugar-free options are usually preferred. And remember, if you have symptoms like high fever, severe throat pain, difficulty breathing, difficulty swallowing, dehydration, rash, persistent ear pain, pus on tonsils, or symptoms that keep returning, do not rely on a probiotic video. Get medical advice. The safest message is this: Streptococcus salivarius can be an interesting oral probiotic tool, but it should be used responsibly. How to choose a Streptococcus salivarius supplement. When choosing a Streptococcus salivarius supplement in the US, UK, or Europe, look for clarity. The label should say Streptococcus salivarius K12 or Streptococcus salivarius M18. If it only says oral probiotic blend without strain names, you cannot easily connect it to research. Second, choose the right form. For mouth and throat benefits, lozenges or chewables that dissolve slowly may make more sense than capsules swallowed quickly. Third, check CFU through expiration, not just at manufacturing. Probiotics are living organisms, and viability matters. Fourth, check storage. Some products are shelf-stable. Others may require refrigeration. Fifth, avoid unrealistic claims. A trustworthy product should not promise to cure strep throat, replace antibiotics, reverse cavities, or eliminate bad breath permanently. Sixth, consider the complete routine. For throat health, hydration, sleep, avoiding smoke, and medical care when needed matter. For oral health, brushing, flossing, tongue cleaning, and dental checkups matter. Seventh, think about timing. Many people use oral probiotics after brushing before bed, but always follow the product instructions. Finally, if using antibiotics, ask a clinician about timing. Antibiotics may reduce probiotic survival if taken too close together. A good probiotic strategy is not about chasing the highest number, it is about choosing the right strain for the right purpose. Common mistakes people make. The first mistake is thinking all Streptococcus bacteria are harmful. They are not. The genus includes many different species, and some are normal members of the human microbiome. The second mistake is ignoring the strain name. K12 and M18 are different. Strain-specific evidence matters. The third mistake is expecting instant results. Oral microbiome changes may take consistent use, and results vary from person to person. The fourth mistake is using a probiotic instead of medical care. A probiotic should not replace a strep test, antibiotics when needed, dental treatment, or evaluation for serious symptoms. The fifth mistake is using mouthwash aggressively while trying to support the oral microbiome. Some antiseptic mouthwashes may reduce bacteria broadly, including helpful microbes. This does not mean mouthwash is always bad, but it should be used with a purpose. The sixth mistake is forgetting the basics: sleep, hydration, oral hygiene, and diet. The seventh mistake is buying based only on CFU. With oral probiotics, strain and delivery method can matter more than a huge number. The final mistake is expecting one supplement to fix everything. If bad breath comes from gum disease, reflux, tonsil stones, dry mouth, or dental infection, the root cause must be addressed. Final summary. Streptococcus salivarius is one of the most fascinating oral probiotic species because it lives where many oral health problems begin: the mouth and throat. The two most important probiotic strains are K12 and M18. K12 is mainly discussed for throat health, tonsil health, pharyngitis recurrence support, upper respiratory microbiome balance, and bad breath. M18 is mainly discussed for dental health, plaque, gum support, and interactions with Streptococcus mutans. The science is promising, but it must be explained responsibly. Streptococcus salivarius is not a cure-all. It does not replace antibiotics for confirmed Group A strep infection. It does not replace brushing, flossing, fluoride, dental care, or medical evaluation. But as part of a smart oral health routine, strain-specific Streptococcus salivarius probiotics may offer a targeted way to support the oral microbiome. So, when choosing an oral probiotic, remember these 3 rules. First, check the strain. Second, match the strain to your goal: throat, breath, or dental health. Third, keep expectations realistic and combine the probiotic with good oral hygiene and professional care when needed. The next time someone says all bacteria are bad, remember, some of the most interesting health stories begin with the friendly microbes already living inside us. If you want to understand how your body really works and the benefits of probiotics, Subscribe to this channel because we turn complex scientific topics into simple and powerful information that you can actually use. And if you found this helpful, share it with someone who cares about their health.